In today's topic, we would be discussing towards better health. Control of harmful microorganisms. The control of harmful microbes includes removal, inhibition of growth, or killing by physical agents, processes, and chemical agents or antibiotics. Some common methods of controlling harmful microorganisms to maintain good health include high and low temperature, boiling or heating of food, pasteurization of milk, sterilization of medical instruments, and freezing of food to reduce the activities of microbes to the barest minimum. Covering of food, prevent vectors and pathogens in the air from coming in contact with the food. Antibiotics, drugs such as ampiclox, ampicillin, penicillin, and tetracycline are used to kill many bacteria causing diseases. Antiseptics, substances such as Dettol, Milton, chlorine water, medicated soap, and hydrogen peroxide destroy microorganisms, while others prevent the multiplication of the microorganisms. Disinfectants, stronger antiseptics, such as Sanitors, Lysol, and Izol, are used to disinfect hospitals, warehouses, and public buildings. Antiseptics and disinfectants have to be diluted to render them gentle or mild to the skin. Vectors and ways of controlling vectors. A vector is an animal that transmits disease-causing organisms, pathogens, from the victim of that disease to another person. Control of mosquitoes. Clearing of bushes around houses. Spraying swamps or rooms with insecticides. Use of drugs. Control of houseflies. Spraying with insecticides. Covering of food. Keeping the environment clean. Maintenance of good health. There are many ways of maintaining good health, including refuse disposal. Refuse is solid waste material discharged through human activities from homes and industries into the environment. Reckless refuse dumping around dwelling places creates bad odor and provides breeding grounds for insects and rodents that spread diseases. Refuse disposal can be done through the following ways: provision of dust bins in strategic locations, burning of refuse in incinerators, dumping them in isolated areas far from human habitation, and burying refuse in sanitary landfills. Sewage disposal. Sewage is wastewater material discharged from laundries, kitchens, toilets, and bathrooms, e.g., urine and feces. Sewage disposal is done through the use of pit toilets, where feces and urine are passed into deep pits, the use of septic tanks, where water is used to flush feces and urine into a big tank dug in the ground, and community treatment processes, where sewage from various homes is collected and treated before being discharged into the oceans or rivers. Protection of water. In view of various diseases that man contracts because of drinking unclean water, water should be protected through the following ways: addition of alum to water, boiling of water before drinking, filtration of water on cooling, addition of chlorine to kill microscopic germs, and storage of water in clean containers. Protection of food. The following methods of food protection are recommended: keep food in refrigerators or deep freezers, boil or cook raw food properly before eating, inspect food meant for public consumption, wash hands before and after eating food, preserve food through canning, keep the environment where the food is prepared clean, and avoid exposure of food to flies and other microorganisms. Roles of health organizations. The administration of health services in Nigeria is achieved through the following approved organizations: Ministry of Health, University teaching hospitals. Countries cooperate to tackle health issues. At the international level, health control is organized to prevent the spread of diseases and also to provide aid to needy areas. This aid can be in the form of drugs, medical equipment, money, etc. International health organizations include World Health Organization, WHO. This is the world's principal agency for dealing with health and nutritional problems. It was established in 1964 and became operational in 1948. The functions of WHO are as follows. It provides and assists national governments at their request to strengthen their health services. It promotes and provides improved methods of training health and medical-related professional experts for member countries. United Nations Children's Fund, UNICEF. This is a body set up by the UN. It performs the following functions. It provides emergency needs for children in areas affected by diseases or famine. It improves the nutritional condition of undernourished children. International Red Cross, IRC. This is a humanitarian organization whose functions are to serve humanity during peace and war times. During war, it performs the following functions. Care for the injured. Provision of emergency aid. United Nations Educational, Scientific and Cultural Organization, UNESCO. Although this is not directly a health organization, it assists health services indirectly by raising the educational standards of the people in developing countries. Thanks for watching. See you in the next video.